Thank you very much, Dr. Dan. I have been told on at least 4 occasions since being here that the name McDonald is not very good for a dietitian, and I have to agree, it is not. Not a very good name for a dietitian. In fact, somebody said to me, it's okay though, as long as you're promoting the green arches and not the golden arches, we will be happy. We can live with that. So despite my name, I thank you very much, Dr. Dan, for the kind invitation to speak with you at this inaugural event. I have been to Romania once before, and that was to speak at a nutrition congress in Bucharest about 4 years ago. But it is a real pleasure and privilege to be able to come back again, and especially this time to be in the beautiful region of Targu, Mures. Hopefully I got that right. Now, I should tell you that the pastor of the local church that I attend at home in Australia is actually from Romania. And he is a young, energetic, passionate, very intelligent young man, very similar to a lot of the people that I've met this week. But he has captivated us with stories that he's told us about growing up in Romania. And so even though I don't personally know this country very well, I feel that I have an affinity with it because of the stories I've heard from him. So I have 3 presentations over the next 3 days, and I've titled the first of these from Sanitarium, from Weet-Bix to Wellbeing. Now hopefully this will make a little bit more sense once I've had the chance to give you a background on what that means. But the 2 main reasons for the presentation are firstly to share with you some very practical applications for the field and the discipline of dietetics within the community and within public health and the food industry, as Dr. Dan has said, and also to share with you some potential work opportunities beyond the field of hospitals. So I work for Sanitarium, which is the largest health food company in Australia, and we employ about 14 dietitians across all of the activities that Sanitarium does. And I'm pleased to be able to tell you that a lot of the things that I'll share with you today are pilot programs, and so we're testing at the moment. And as we find that these work, and as we look to expand them, we will be looking for many more dietitians to work with us. And in fact, I estimate that in about 10 years' time, we could have as many as 40 to 50 dietitians working with us. So we might be very interested to talk with you along the way. So hopefully this will give you some hope. Okay, well let's get started. So first I need to give you some background to the company of Sanitarium. So it's a health food company, as I said. It was founded about 114 years ago. So it was established on the advice of a very visionary and passionate lady who had, as I said, a real passion for health, and her name was Ellen White. She worked at the Battle Creek Sanitarium in Michigan in the United States that Dr. Connell spoke about yesterday, when he talked about how one of the dietitians there, Lena Frances Cooper, was the dietitian that started up the American Dietetic Association. So for those of you who don't know, Battle Creek Sanitarium was a health retreat and hospital, and it was very famous in its time. It had a number of celebrities and movie stars and even presidents of the United States and very top level people from places around the world that would come and stay there during the 18th and the early 19th century. Now the name Sanitarium, I laugh a little because in the United States, if you say this name slightly wrong and you say sanatorium, people think it's a mental health institute. Now, I don't work for a mental health institute, I work for Sanitarium, and that word is actually created from a Latin word which means learning to stay well. So it was Ellen White that actually helped to set up that original sanitarium at Battle Creek. And after she'd done that, she moved to Australia, and she then encouraged some people there to set up the Sanitarium Health Food Company to make products, healthy products to share with people in our country. Now, interestingly, Sanitarium has a sister company here in Romania, and I think you'll know it very well, Sanivita, and it has the same background and philosophy as what Sanitarium does. So the advice to Sanitarium was to create foods that are as wholesome as possible and as close to their natural state as possible. Very similar to the Sanivita products that you have here. So healthy cereals, soy milk, dried fruits and nuts, and many also different vegetarian foods. So it was from this use of wholesome plants that the recipes for our Sanitarium products were created, including what is now known as Australia's leading and most loved breakfast cereal, which is called Weet-Bix. Now, this is what your Romanian company, Sanivita, has with the Bixie's products. So I hope you can see the likeness there. This is not our current packaging, of course. It's from when it was first developed. Now, just to give you a little bit more context on Sanitarium, and then we'll move on to talk about the different initiatives. The mission for Sanitarium that it was founded on was to share with our community a message of health and hope for a better life. And also, I guess it's fair to say that this is a bit of an unusual company because it's actually owned by a church, and so it's a not-for-profit company. And so the reason for its existence is not to make lots of money to give on to people, but rather for its philosophical purpose of genuinely caring for the health and the hope and the happiness of people in the community, and also to promote health of the whole person. So not just looking at physical health, but also looking at mental health, emotional health, social health, vocational health. I don't know if you have that word here, but it means what's your life purpose and how can you contribute to the community, and of course also spiritual health. So the company was established about 114 years ago, but you might be wondering what Sanitarium looks like today, and I'll just give you a very brief snapshot of that. So we, in terms of some statistics within Australia and New Zealand, now we have the leading breakfast cereal, the leading soy milk, which is called So Good, again similar to the Sanivita one, and the leading vegetarian meal products in Australia and New Zealand. But the interesting thing, and this is relevant to what else I'm going to talk about, is that the Weet-Bix product is so much loved in Australia that about 3 years ago it was awarded the Australia's most favourite brand out of all brands, not just foods, but of every brand in the country. So that's a very significant thing that we were clearly very excited about. So with this background in mind, I can tell you now more about what this presentation is about. So from Weet-Bix to Wellbeing. This was the title of a press release that we released to the media about 2 years ago when we launched one of our first new health and wellbeing concepts in the community, and it was called Sanctuary Health and Wellbeing Village, and I'll talk about that. But if you think about what I've just said, for a company who has Australia's most loved brand, this is a bit of a significant statement and perhaps a little bit provocative, but it was designed to capture people's interest and let them know that Sanitarium was really interested in health and well-being, not just in selling food products. And that's what I want to share with you over the rest of the presentation, because Sanitarium's interest in that area has practical application for dietetics and also can provide, as I said, additional work areas for dietitians in the future. So when you consider that the name Sanitarium means learning to stay well, it means that our goal is to be leaders in health and wellbeing and to help people to do just that, to be able to learn to stay well. And so for this reason, we have deliberately extended our portfolio over the last couple of years to now include, in addition to the food part of the business, a new part of the business called Health and Wellbeing Services, and this is the area that I head up. Both of these areas play a unique role in helping to improve health and wellbeing with the community. Firstly, the foods, because they're actually helping people to make healthy eating choices, and secondly, the services which can help people in other areas of lifestyle and well-being as well. Just to give you a bit of a picture, we have about 7 dietitians working on the foods part of the business, and we have about 7 dietitians working on the services part of the business. But it's the services part of the business where we'll have a lot of growth in the near future, and we'll be looking for many more dietitians to help us. So within this, health and wellbeing services, its overall strategic goal is to drive an integrated program of engagement that can achieve 4 key things. Firstly, to make a real and tangible difference in the health and wellbeing of people in our community, just as we were saying before. Secondly, to bring to life the philosophy of genuine care for whole person health. Thirdly, because Sanitarium would like to take a leadership position in this area. And fourthly, to yield a return, not for the sake of making money, but for us to invest into more and more health service programs to further help with health and wellbeing in Australia. And so within that program, integrated program of engagement, we have 6 key areas that we're driving to achieve all of these goals. And so Dr. Dan has asked me in this first presentation to give a very brief overview of each of them, and then in my second and third presentations I'll be able to go into more detail on these various projects. So the first area is called Sanctuary, and this is the one that we launched about 2 years ago. So it's a health and wellbeing centre, or village, as we like to call it. Now, Sanctuary is based on a number of key elements that package up to make this a unique destination for receiving whole person healthcare. It offers an ideal balance between conventional medicine and also complementary therapies, and it has a wide range of services all under all in the one location. Now, this first one that we set up about nearly 2 years ago is a pilot, and we're testing to see how well this works, and then we look to roll this out. Now, the range of services that we have there, just to give you a bit of an idea, we are able to have one-to-one consults with practitioners, and you can see from on the screen here all of the various practitioners that are involved, including, of course, the dietitian. And we also have a wide range of massage and skin health therapies, and also we have a lifestyle studio where we run a number of health programs about weight loss, reversing disease, cooking workshops and exercise classes. So what's our goal here? Well, we would like to become the leading destination for whole person healthcare in our community, and we have the aim of having about 10 to 15 of these different sanctuary centres in Australia and New Zealand over the next 10 to 15 years. Currently, we're doing well. We've had very good feedback from people who have come to visit and have said that they find the level of care exceptionally high there. We're currently running at about 50% capacity, and we expect to be at 100% capacity by early 2014. Now, this slide just gives you an indication of the average number of consults per month since we opened. And you can see that there is good growth there. Now, just to also share with you, we've just recently gone through a strategic planning process on this and the other projects that I'll talk about as well. And we look here at how we believe we will be able to grow over the next 3 years based on the historical data to date. And so whereas at the moment we're currently providing about 12,000 consults per year, by the time we get to 2014 to 15, we will be having about 36,000 consults per year. And what we've been able to calculate is that at that time we will be reaching and interacting with about 20% of our local population in that area. So we're excited to be able to make a meaningful difference in that community. And at that point, we will then be ready to look at rolling this concept out to the other centres. So around about 12 months from now, we actually will need another dietitian within this Sydney centre. So hopefully you get a bit of a picture here, because if we need 2 dietitians per centre, and we're planning to have 10 to 15 of these centres over the next 10 years, we could be needing as much as 20 to 30 dietitians just for this initiative alone. So that was the first area, Sanctuary. Sorry, I should just show you some pictures. This gives you an indication of the location of Sanctuary. It's right on the harbour in Sydney, in a lovely heritage listed building, and I'll just quickly show you some photos. So that's the building is the one in the middle there. It doesn't have the signage on it. I should get a picture with the signage on it. This is the entry from the street. This is looking at our reception and waiting areas, looking down towards where the practitioners have their consult rooms. This is our dietitian, our physiotherapist. This is where our exercise physiologist has their studio. And this is in our lifestyle studio, where we have our dietitian and our chef running some cooking demonstrations. We also run from the lifestyle studio either group or individual Pilates and personal training services. And this just shows a picture of one of our day spa rooms and the waiting area there. So the second area for health and wellbeing services is our Cultivate program, which is a workplace health service, and we talked a little bit about this kind of thing yesterday. Now, the kind of services that we provide there, and I should just say, this is where we have a business or employers engage us to come in and provide services for their employees. And the sorts of activities and services that we provide can be a themed calendar of health and wellbeing services over a 12-month period. We also run workshops and cooking classes and exercise classes. We run health assessments and audits so that we can go back to the business owner and say, in your working population, you have real risk of this and this and this issue, and it's affecting this much of the population. And then we can come back in and provide tailored services for the people. Probably the thing that we've found the most effective there is personal health coaching, which can be done by a dietitian or by another health professional, although it needs to be the right one, that can walk people through these various things. And so, as I said, this is very much aligned with what Anne Deloy was sharing, and a number of the other speakers have been sharing with us over the past couple of days, and that is that we have to be able to very clearly understand what it is that businesses are looking for, what their needs are, and then we have to be able to sell to them and demonstrate to them that we can meet and are meeting those needs. So this is where the whole idea of marketing yourself and being able to demonstrate the benefit of the service comes in. So where are we at with this? Well, what we want to do in terms of the goal is to be a leading provider of whole person health services in the corporate health market in Australia and New Zealand. And we would like to have between 50 to 100 clients in about 5 years' time. And so this is where it's important that there is research to show, and that we conduct research as we go, to show that the health programs we offer can deliver happier, healthier workplace and culture, and more engaged and more productive employees, that then delivers a return to the bottom line of the business. And on average, when you look at the data of research that we and also others have done, it's typically a return on investment of about 5:1. So it is really quite marketable to the businesses. Now, we launched an internal program to Sanitarium about 3.5 years ago, and we got some great results with the programs that we were running there, and then we were able to share those with the external market about 2 years ago. Now, On Friday, I will be able to go into more detail on this, but I will be able to tell you how from January of this year, where we had about 18 clients and employed 6 health professionals, we've now gone, as of this month, to having 100 clients and employing over 100 health professionals just in this area alone. So because of time, I will share more about that on Friday with you, but this is an area that we will continue to grow. The third area of health and wellbeing services is a cafe called Kitchen, and it is a healthy whole foods cafe that serves wholesome and delicious foods to busy workers in the city of Brisbane. We have a great menu with really great options for breakfast and lunch and healthy snacks. Also good takeaway options, healthy drinks, and also special diets like lactose-free and gluten-free. And this was opened in April 2008, also as a pilot, just to be sure that we could make this model right. And our goal, similar to the other ones, is to be a leading cafe destination in our community, and we would like, once we have this first one right, to roll that out to 10 to 15 cafes in Australia and New Zealand over the next 5 years' time. Currently, or just to give you an idea of the number of meals that we're serving through there, when we first started it was about 60,000, and now in the full year just gone, we've served 85,000 meals. And I guess as we look to the future here, I'd like to see more and more dietitians involved, because there will be opportunities for menu planning. But thinking beyond that, I think it would be great to have an adjoining room next to the cafe where people can also book in to taste, to have a consultation with a dietitian after having tasted that the food is good and it's tasty. There hopefully may be more interest in understanding, so how can I eat this way more often? Again, just quickly, I'll show you a couple of pictures. This is looking from the outside in. We actually have a garden area there now that's not showing there. This is the servery and counter area, some of the eating areas, some of the great fresh and tasty foods, and some of our takeaway options. Okay, so continuing to move along, the fourth area for health and wellbeing for us is our Sanitarium nutrition service, and it has the purpose of inspiring and resourcing people to make healthy eating choices. And we've provided this service, this is the oldest one in the family, for about 24 years. So our real focus here is to promote the benefits of plant-based eating. We've heard so much just over the last few days of the benefits of plant-based eating. And so we run a number of different communication and resourcing programs that set out to equip people with this information and recipes to start to make these choices. And so on Friday, I will cover this particular area in a little bit more detail, but that just gives you an example of some of the newspaper articles and booklets and cookbooks that we have prepared. Okay, about 18 months ago, when we looked at what we were doing in the nutrition service, we decided that we wanted to take more of a community engagement approach that would be more likely to deliver tangible results. Because in the Sanitarium nutrition service, when we send out our information, we recognise that it is just that, information, and we're not sure how people are going to use it. We're not sure if it's going to actually result in behaviour change. And so we're now in the process of transitioning that nutrition service to a new department called Lifestyle Medicine Services, which is much more orientated around behaviour change and really supporting people to make behaviour change. Now this of course keeps food and nutrition right at the core of what we're doing, but it puts it in a broader context of lifestyle and the paradigm of lifestyle medicine and even disease reversal. Now the key program that we have sitting in this is a program called CHIP. Now, CHIP doesn't stand for potato chips or chocolate chips. It's an acronym that stands for Complete Health Improvement Program. And I will just briefly share with you what this is about. So about 11 months ago, we bought the global rights for this exciting program. It comes from the US. It was founded in the US. And it's a 30-day program that looks at really encouraging people to increase the amount of plant foods that they're having, to reduce the amount of animal foods that they're having, to increase the amount of nature's whole foods, and to reduce the amount of refined and processed foods that people are eating. It's run in a community setting. Usually there's a group of about 15 to 20 people that sit in on that, and so there's great social support and accountability for being on that program. The program, while it's new to us, has been in existence for 25 years, and there's been 50,000 people go through that program already, and there's been quite a deal of research and evidence to show that it can make a significant difference. Now, the whole program is built on the paradigm of lifestyle medicine, and so I wanted to just talk a little bit more about that. We have already had about 20 peer-reviewed scientific journals showing the benefits of people going onto this program, but I have some exciting results that I'll quickly share with you today. I'll expand more on Friday, but it will give you a good taste of the results that a program like this can achieve. So in January of this year, there was an article published in the American Journal of Cardiology that looked at a group of people, 5,000 people, who went through this program in a 30-day period, and the results that are up on the screen look at those that went in with the highest risks, at the highest levels of blood cholesterol or blood pressure, etc. But you can see just from looking at that at a glance that it delivers some really exciting results when you consider a 20% reduction in cholesterol, 44% reduction in triglycerides, and also about a 20% reduction in fasting plasma glucose. When you look at these, you can see that these are about as effective as what some of the medications can achieve. For example, statin for reducing high blood cholesterol, and the others are similar as well. And so we see ourselves running quite a number of these programs through our communities in Australia and New Zealand. And again, there's a very, very clear role for dietitians to help to share this program with people in the community. Okay, so moving towards wrapping up, the last two areas are our public health advocacy and health professionals program. Now, I'm not going to talk really about this at all today because I'll be spending my whole talk tomorrow talking on this particular area, but in essence it's about influencing the influencers. So let's come back to the big picture. Why is Sanitarium doing all of this, and what do we hope to achieve? Well, all of these areas are fairly new, and we're still in the process of establishing them and growing them. We've faced numerous challenges and difficulties as we've set out to do them, but we're focused on our vision, and we will continue to work to make these happen. We've just, as I mentioned earlier, we've just been through a strategic planning process where we look at what do we realistically think we can be achieving in 3 years' time based on where we are now, and I'll just quickly share that with you. So we should be in a position where we're delivering to a strategy of helping more healthy people in more places and delivering real and tangible benefits. We estimate that by the year 2015, we will be conducting about 200,000+ health interventions and consults, and serving about 100,000 meals through our cafes. Our initial focus is in Australia and New Zealand, obviously, and also in the US, because the CHIP program is also in existence there, but we hope to then look further afield. And of course, the benefits that we're providing for people are not just reduced risk of disease and reduced disease, but also increased sense of well-being and increased quality of life. So this is my second last slide. And when we get to the year 2015, we'll be in a position where we can say, okay, we're now going to roll out these sanctuary programs so that we have 10 to 15 of them. We'll further increase the presence of our Cultivate Workplace program. We can roll out 10 to 15 more of the kitchen cafes. And something that we're very keen to do is to be able to take the CHIP program to countries beyond the ones that I mentioned before. So this is what Sanitarium has as its vision, to help people, to achieve our mission and to help people to live more. But just in finishing up and to come back to what hopefully is most relevant to you, I'm hoping that you can see that there are many opportunities for dietitians beyond hospitals, many opportunities for dietitians to work, to make a difference in the communities that they're serving. So in conclusion, I just wanted to finish with this quote by T.E. Lawrence. And it says, "All men dream, but not equally. Those who dream by night in the dusty recesses of their minds wake in the day to find that it was a vanity. But the dreamers of the day are dangerous men, for they may act," and that's the key word, and Dr. Dan spoke about the importance of acting on our dreams. They may act their dreams with open eyes to make it happen. The very last thing that I want to say is I've learnt some very powerful Romanian words this week from Mihai, and I hope I do him justice as I try to pronounce them. Here's my attempt. Insupatul este greu. Does that sound remotely familiar? I'll say it again. Insupatul este greu. What have I tried to say? Can you tell me? Oh, there he is. He walked in right at the right time. I've learnt that this means the start is hard. And the start is hard. The start has been hard for us in the various projects that we've tried to develop in Australia, and I know from talking with you the start has been hard for establishing a role for dietitians in Romania. But I want to say that we are companions on this journey where the start is hard, but if we keep focused on the vision and on our dreams, and if we act on them, and I believe we can do that, it will come to life. We will get there and it will be worth it. Thank you.